Research is on to find out how many people have had COVID-19. And hospitals in Bournemouth and Poole have been chosen to take part in the research, testing as many staff as possible. But it's still not known if an antibody response will give future immunity. Our health correspondent Alistair Fee reports.
Mark has been caring for patients with COVID-19.
It was challenging and very scary at the same time. Hello, good afternoon.
Today he's getting tested to see if he's had the virus.
It will reassure me to a certain degree that, if I do have the antibody, that means I was exposed to it. And for me and my family, it means that if I do pick it up again in the future, I'll be twice as strong because I also already have the antibody to fight it.
That's what everybody hopes, but there's no evidence to back that theory up yet.
Be interesting to see if immunity is what we think it's going to be, whether it lasts as long as we hope it will. We've got two phlebotomists on tomorrow morning.
Lindsay normally works in orthopaedics, but is helping run this research.
I became unwell at the end of March. I had headaches, eye pain, body pain, and then shortly after lost my sense of smell and taste, which at the time wasn't listed on the notifiable symptoms. So I was keen to know whether I had actually had COVID or not, and my test came back positive.
This lab in Poole is where the samples are sent.
We know at the moment that of all the tests that we've done, around 11% of those tested are coming out as positive. We'll see whether that percentage is growing in the population. So there'll be a lot that will contribute to the body of knowledge. So at the moment, the test makes no difference for us in terms of what we can do. It makes no difference in terms of spread. We all have to be equally careful. But the point is that over time, it will be hugely important for public health.
Each sample, like this, is a patient.
It's a complicated process, mixing medicine and engineering, and it's already having benefits.
It's been a surprise. We all thought there'd be a higher rate of positivity. Now, you've probably heard of people complaining of symptoms and insisting, I must have had the condition, but it would appear a lot of those patients are actually negative for the antibody. So it's a surprising finding insofar as we thought the numbers would be higher.
The voluntary test is for all NHS staff. It'll then be offered to other key workers before being made available to the public. There is still so much about coronavirus that's unknown. This will help answer one of the big questions, whether those with antibodies have any protection and a lower risk of reinfection. Alistair Fee, BBC South Today.